Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a physician talking to a patient called Mrs. Lawson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Lawson. I'm Dr. Fields, a specialist in vascular medicine. How are you feeling today?
Hi, Dr. Fields. I'm not feeling great, to be honest. My leg has been really bothering me.
I understand. I've reviewed the notes from your GP, and it looks like you've been dealing with pain and swelling in your left leg. Could you tell me more about when these symptoms started?
Sure. It started about a week ago. At first, I thought it was just a muscle strain, but then my calf started to swell and the pain got worse, especially when I walk or stand for too long.
I see. Do you recall any recent injuries to your leg, or have you been immobile for an extended period, like after a long flight or being bedridden?
No injuries, but I did have a long flight about 2 weeks ago. I was sitting for almost 12 hours, and since then I've noticed this pain.
That's helpful to know. Based on your symptoms and the timing after a long flight, I'm concerned that you may have developed deep vein thrombosis, or DVT for short. It's a condition where a blood clot forms in a deep vein, usually in the legs. Have you heard of this before?
I've heard of blood clots but didn't realize they could be related to travel. How serious is this?
It can be serious, and that's why it's important to diagnose and treat it early. DVT can cause pain and swelling as the clot obstructs blood flow in the vein. The major concern, though, is that part of the clot could break off and travel to your lungs, which would cause a pulmonary embolism. That's a medical emergency, so we want to make sure we address this as soon as possible.
That sounds scary. How do we find out if I really have DVT?
We'll start by performing a Doppler ultrasound of your leg. This is a non-invasive test that uses sound waves to create images of the blood flow in your veins. It will allow us to see if there's a clot and where it's located. If needed, we might also order a D-dimer blood test to check for elevated clotting factors in your blood.
Okay, and if it's confirmed, what's the treatment?
The standard treatment for DVT is anticoagulant medication, commonly referred to as blood thinners. Medications like heparin or warfarin help prevent the clot from growing and reduce the risk of new clots forming. Treatment typically lasts for 3 to 6 months, but it can vary depending on your situation.
Blood thinners sound dangerous. What if I start bleeding a lot?
That's a valid concern. Blood thinners do increase the risk of bleeding, but we carefully monitor the dosage to balance the benefits of preventing clot growth with minimizing bleeding risk. We'll provide you with guidelines on how to manage any side effects, and we'll check in regularly to make sure the medication is working properly.
Are there any other options besides blood thinners?
In some cases, if the clot is large or causing severe symptoms, we may consider other treatments like thrombolysis, which involves breaking up the clot with medication delivered directly to the affected vein. However, this is usually reserved for more severe cases. For most people, blood thinners are highly effective.
That's good to know. So, What happens if the clot doesn't go away with treatment?
The clot may not dissolve completely, but the body often absorbs it over time, and the medications help to reduce its size and prevent complications. It's also important to manage risk factors to avoid future clots, staying active, moving around during long periods of sitting or travel. And wearing compression stockings can help improve blood flow in your legs and prevent DVT from recurring.
I'll definitely keep that in mind for future flights. Is there anything else I should do in the meantime?
Yes. In addition to the ultrasound, I recommend that you avoid long periods of inactivity while we await the results. Try to keep moving regularly, even if it's just walking around the house. Also, elevate your leg when resting to reduce the swelling. If you notice any sudden chest pain, shortness of breath, or rapid heart rate, seek emergency care immediately, as these could be signs of a pulmonary embolism.
Got it. I'll make sure to keep an eye on that.
Good. Once we have the ultrasound results, we'll be able to confirm the diagnosis and start treatment right away. With proper care, most cases of DVT are manageable, and will work together to reduce your risk of future clots.
Extract 2, questions 13 to 24. You hear a neurologist talking to a patient called Mr. Amit Patel. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, please come in. Are you Mr. Amit Patel?
Yes, that's right.
Amit, I understand you've come in today to discuss some recent health issues linked to polio. Can you tell me a bit about what's been going on?
Yes, it's been quite a journey, really. I contracted polio as a child, but I've mostly been fine since then. Lately, though, I've been feeling a lot of fatigue, and my muscles feel weaker, particularly in my legs. I didn't think polio could still affect me this way, so many years later.
I can see why that might be surprising. It sounds like you might be experiencing what we call post-polio syndrome. For some people, symptoms can resurface years or even decades after the initial infection. How long have you been noticing these symptoms?
It's been about a year now. At first, I thought it was just getting older. I'm 52 now, but it started affecting my daily routine. Sometimes I struggle to walk up the stairs or even get up from a chair, and I'm exhausted by midday. It's frustrating because I've always been fairly active.
I understand. Many people with post-polio syndrome report similar experiences, and the onset can indeed be gradual. Besides the fatigue and muscle weakness, have you noticed anything else unusual, like changes in your ability to perform specific tasks?
Actually, yes. I used to play the piano for my family gatherings. Recently, my fingers feel stiff, and my hand strength isn't what it used to be. Even holding a glass of water can be challenging at times. I've also started to notice some pain in my muscles, especially after physical activities.
That's helpful information. Pain and muscle stiffness can accompany the syndrome, especially after exertion. Let's go over your medical history. Any other conditions or medications you've been taking recently?
Nothing major, thankfully. Just a bit of hypertension, for which I take medication daily. Other than that, it's really just this muscle weakness and fatigue that's been holding me back lately.
Understood. When you were first diagnosed with polio as a child, did you experience any long-term effects or mobility issues growing up?
Yes, I had some difficulties with my left leg when I was younger. My parents got me a brace, and I had physiotherapy sessions for several years. Thankfully, I was able to walk normally after a while and didn't need any aids as I got older.
That's great to hear. Many post-polio syndrome cases are characterized by a similar history, a long period of normal function followed by a gradual return of symptoms. It sounds like you managed well with the initial effects. How has this recent onset impacted your life? Are there activities you've had to stop or change?
Well, I'm a primary school teacher, and staying on my feet is a big part of my day. Now, I find myself needing to sit more often, and I sometimes feel unsteady when I walk. It's also affecting my social life. I used to love going for hikes and outdoor activities with friends, but now I'm hesitant to join because I worry I might not keep up or might get too tired.
That must be difficult. It sounds like your quality of life has been affected quite a bit. One of the challenges of post-polio syndrome is balancing activity to maintain strength without overexerting muscles that may already be fatigued or weakened.
I see. I've been pushing myself to stay active, hoping it would help, but it seems like I just end up more exhausted afterward.
That's actually quite common. In cases like yours, physical therapy that focuses on gentle strengthening exercises rather than high-intensity activity can sometimes be beneficial. The goal is to find a balance that maintains mobility without worsening fatigue. Additionally, there are some lifestyle adjustments and aids that might be helpful.
That makes sense. I hadn't considered using any aids, but if it helps, I'm open to it.
Absolutely. Some patients find that periodic use of a cane or a lightweight brace can ease the strain on certain muscles, especially on longer walks. It can give you more control and may alleviate some of the fatigue. We can also explore energy conservation techniques, planning activities to avoid overexertion.
That sounds promising. I'd appreciate any guidance on that. I've been feeling like I need a plan to manage this better, especially with teaching.
Of course. I'll refer you to a physical therapist who specializes in post-polio care, and they can create a program tailored to your needs. Also, staying connected with support groups or individuals facing similar challenges can be beneficial.
I hadn't thought of that. It'd be nice to speak to others who understand what this is like.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear an instructor introduction, a session. Now read the question.
Hello everyone, and welcome to today's program. The goal of this session is to provide an interactive, case-based refresher on sports vision and performance enhancement for practicing optometrists working with athletes. This training is tailored specifically for those in clinical practice who want to learn more about optimizing visual skills for sports performance, rather than those pursuing a specialty in sports vision. Our focus will be on areas like visual training techniques, sports-specific eyewear, and managing vision-related concerns in concussion cases. The course is divided into case studies and workshops, each centered around a different aspect of sports vision care. We will conclude with a group discussion on the benefits and challenges of integrating sports vision into primary care settings.
Now look at question 26. You hear a pharmacist talking to a doctor about a patient's progress in a smoking cessation program. Now read the question.
Month.
Oh, great. How is he doing with it?
Well, he's been attending weekly sessions, and we started him on nicotine patches. But he mentioned today that he's feeling irritable and having trouble sleeping.
That can happen as the body adjusts to reduce nicotine intake. Do you think adjusting the dosage might help?
Possibly, but I wanted to check in with you before making any changes. Shall I?
Sure. Thanks for the update.
Now look at question 27. You hear part of a conversation between 2 dentists. Now read the question.
Have you noticed how much emphasis there is now on managing patient anxiety during complex procedures?
Yes, I was discussing that with a colleague recently. It seems they're really focusing on it. There's even a whole section dedicated to behavioral techniques and patient communication.
True, but I think they might be pushing it a bit far, don't you think? I mean, there's only so much we can do to calm patients, especially in cases of severe anxiety.
I don't know. I actually think it's essential. I mean, I get that we're dentists and not psychologists, but learning a few strategies could make a big difference. It could prevent situations from escalating during procedures, especially when patients are already anxious about things like extractions or root canals. And it's part of providing holistic care.
Now look at question 28. You hear a cardiologist briefing a colleague about a patient called Jonah. Now read the question.
Today, we'll be focusing on Jonah. She's 3 weeks post-surgery for a triple coronary artery bypass. She also had a blockage removed from her left anterior descending artery. This is her first time in cardiac rehabilitation following the surgery, right?
Yes, that's correct.
All right, so today, we're going to start with low-impact aerobic exercise to improve blood circulation and prevent any scar tissue from developing around the heart muscle. This approach should help strengthen her heart gradually. The goal is to see consistent progress with her cardiovascular endurance, so eventually she can handle her daily activities without strain. Cardiac rehabilitation is all about controlled movement, helping her rebuild heart function step by step.
Now look at question 29. You hear a senior emergency physician discussing the use of tranexamic acid. Now read the question.
So, regarding TXA and epistaxis, the largest randomized controlled trial we have shows that TXA doesn't significantly reduce the need for anterior nasal packing compared to the usual treatment. But keep in mind, there were some limitations. The study mostly included older men who were on anticoagulation therapy, and the TXA dose they used might have affected the results. So, while TXA has its place in some cases, it's not necessarily the answer for everyone. Traditional nasal packing still seems more effective based on the available data.
Now look at question 30. You hear a nurse asking a colleague for advice. Now read the question.
Whose case I'm finding a bit concerning.
I'm happy to help. Are you referring to young Emma from the inner city? I spoke with her mother last week. She's been very worried.
Yes, that's the patient. Emma has been having persistent breathing issues and was diagnosed with mild asthma after visiting the clinic several times with coughs and shortness of breath. She lives in an area with a high level of pollution, and her family mentioned that she often plays outside. Her mother said Emma has become more fatigued lately, and her symptoms seem to be getting worse.
It sounds like both Emma and her family could benefit from consulting a respiratory specialist to better understand how environmental factors might be affecting her lung health. An asthma educator could also provide them with strategies to manage her symptoms and adjust her lifestyle. This type of condition requires careful monitoring and guidance. That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Laura Kelly. You now have 90 seconds to read questions.
Migraines and headaches are extremely common and can be debilitating for many people. Recently, Dr. Laura Kelly led a trial to explore management strategies for both conditions. Dr. Kelly, could you start by explaining how migraines differ from other types of headaches?
Certainly. A migraine is a specific type of headache with distinct symptoms, often including severe throbbing pain on one side of the head, nausea, and sensitivity to light and sound. It's typically classified as a neurological condition, rather than a basic headache, which can be caused by muscle tension or sinus issues. In fact, migraines can last from a few hours up to 3 days, and, in severe cases, interfere with daily life much more significantly than common tension headaches.
Are there any common triggers or patterns that you see among people who suffer from migraines?
Yes, many people report specific triggers, though they can vary widely. For some, it's related to stress or lack of sleep, while for others, it could be certain foods, like aged cheese or processed meats. Even caffeine intake can play a role. Women are often more affected, and there's evidence suggesting hormonal fluctuations around menstruation can trigger attacks. Other common triggers include bright lights, strong smells, and weather changes. However, pinpointing exact triggers can be challenging, and it often requires keeping a detailed headache diary over time.
Interesting. So, in the study you conducted, what management strategies did you explore?
We had our participants divided into 3 main groups. The first group was given preventive medications commonly prescribed for migraines, such as beta blockers or certain anti-seizure drugs. The second group received non-pharmacological interventions, including cognitive behavioral therapy or CBT, along with lifestyle advice on diet, sleep, and hydration. We call this the holistic management group. The third group was instructed to make no changes initially, adopting a wait-and-see approach to gauge if their condition would improve over time.
And I understand you focused on something called trigger management in one of the groups.
That's right. We found that understanding and managing triggers is crucial in migraine treatment. The holistic management group was coached on avoiding or reducing triggers as much as possible, whether it was dietary, environmental, or related to their routine. For example, we encouraged regular sleep schedules and reducing screen exposure before bed. It's a bit like teaching someone to recognize patterns in their own condition, giving them a sense of control, rather than feeling overwhelmed by unpredictable attacks.
So, what were the findings in terms of effectiveness among the groups?
The results were very telling. For the first month, those on preventive medication reported the highest decrease in migraine frequency. However, by 3 months, the holistic management group reported nearly the same improvement, and interestingly, after 6 months, both the medication and holistic groups had similar results. But those in the holistic group reported feeling more empowered and better able to handle their migraines independently. The wait-and-see group showed some natural improvement, but it wasn't as significant.
Based on these results, what would you recommend to someone struggling with migraines?
For anyone who's experiencing migraines for the first time, I'd recommend they start by tracking their patterns and lifestyle factors to identify any triggers. If the migraines persist, they may want to explore holistic strategies, particularly those focused on routine and trigger management. Preventive medications can be highly effective, but are usually considered after lifestyle changes have been tried. And of course, in severe cases, a combination of both medication and lifestyle strategies may be necessary.
Extract 2. Questions 37 to 42. You hear Dr. Nolan Spencer giving a detailed presentation on patient autonomy and shared decision-making in healthcare. Now, read the questions. You now have 90 seconds to read questions.
Good morning. I'm Dr. Nolan Spencer, a clinical ethicist and professor of medical ethics. Today, I'd like to talk about a crucial aspect of patient care that is often underestimated: patient autonomy and shared decision-making in healthcare. Let's consider a case study. A 58-year-old woman with chronic kidney disease needed to make decisions about her treatment options, specifically whether to begin dialysis or manage her symptoms without it. She was initially inclined to follow her doctor's recommendation for dialysis, assuming it was the best route. However, her healthcare team encouraged her to fully understand all her options, including the potential risks and quality of life implications for each choice. After several discussions, she ultimately decided against dialysis, opting instead to pursue lifestyle changes and symptom management that aligned with her personal values and goals. This decision, shaped by her preferences, exemplifies the power of patient autonomy when patients are informed and involved. Shared decision-making is the practice of engaging patients actively in their own healthcare decisions. This model of care ensures that patients are not merely recipients of medical advice, but rather partners in their health journeys. Evidence has shown that when patients are more engaged in the decision-making process, the outcomes are often better, not only in terms of physical health, but also in mental well-being. When patients feel empowered, they're more likely to adhere to their treatment plans, leading to better health outcomes. I've written extensively on this topic, including a book called Choices in Medicine, which explores the ethical foundations of autonomy and shared decision-making. One chapter delves into the dilemma many doctors face: balancing professional expertise with respecting patients' right to make their own choices.
Surprisingly, I've had readers share personal stories of feeling more connected to their treatment plans after reading about these principles. They often mention that understanding autonomy allowed them to feel a sense of control, even in vulnerable health situations. In some cases, they reported stronger bonds with their healthcare providers because they felt genuinely heard and involved in their care. It's important to note, however, that shared decision-making has its challenges. Take, for example, cases where patients refuse a potentially life-saving intervention. I once worked with a patient who, despite knowing the benefits of a recommended surgery, chose against it due to fears about the procedure. While his choice was respected, his decision had serious consequences that might have been avoided had he agreed to the surgery. This is where a fine line exists, as doctors want to guide patients towards the best outcomes, but must also respect their autonomy. An important part of the decision-making process is transparency. Studies show that when doctors explain potential benefits, risks, and alternatives in an unbiased way, patients are more likely to make decisions they're confident about. Transparency builds trust, a cornerstone of effective healthcare relationships. For example, in the chronic kidney disease case, by presenting the patient with all options and letting her weigh them based on her values. Her team allowed her to make an informed choice that reflected her priorities. Shared decision-making can also prevent unnecessary medical interventions, which may lead to better outcomes. When patients understand that they have the right to ask questions, express concerns, and even say no, they can make informed choices that avoid overtreatment. There's significant evidence suggesting that shared decision-making reduces patient regret and increases satisfaction, two critical measures of healthcare quality. However, reliance on shared decision-making also presents some risks, particularly if patients misinterpret information or lack adequate support. In a recent case, a patient with a heart condition declined medication after researching side effects online. Despite the physician's recommendations, the patient's choice led to complications that could have been mitigated with treatment. This scenario highlights a drawback of autonomy. Without accurate information and guidance, patients might make choices that aren't in their best interest. To me, one of the most important benefits of shared decision-making is the sense of partnership it fosters. When healthcare providers engage in open conversations with patients, it reinforces a model of care based on respect and understanding. This approach acknowledges that patients' values and preferences are essential to their treatment, making healthcare feel more humane. I remain hopeful that as shared decision-making becomes more integrated into healthcare, patients will feel increasingly empowered to make decisions that truly align with their lives and values. For now, while we continue to pursue advancements in medical technology and evidence-based practices, it's essential that we don't lose sight of patient autonomy. Involving patients fully in their own care doesn't only enhance their satisfaction, but it can also lead to healthier, more sustainable outcomes in the long run. The principle of autonomy is fundamental in making healthcare a collaborative, respectful, and patient-centered practice.
That is the end of Part C. You now have 2 minutes to check your answers.